Nicolas Pron, the United Nations Children's Fund Unicef country representative, on Tuesday said mental health affects the development of individuals and their lives. Pron, during the opening ceremony for the 3rd annual Mental Health and Wellness Conference at the Arthur Chung Conference Centre, Liliendahl, said it is necessary that conversations about mental health issues and appropriate responses to its effects are introduced in schools. It is with this in mind that UNICEF has engaged the Ministry of Education to discuss ways that mental wellness can be explored within the curriculum.
Guyana is definitely on the right track to tackling mental health and well-being at the early onset, at the school level. And acting early is one of the best ways to tackle poor mental health. Next year, UNICEF will be gathering available data to support the development of a comprehensive adolescent mental health plan, which will be used to guide implementation of further interventions. Mental health and psychosocial support remains a priority for the UN and for UNICEF, and it is critical to the achievement of the 2030 Sustainable Development Goals.
The conference is a collaboration between the Ministry of Health, the University of Guyana, and several international bodies. The primary objectives are to hold discussions about global responses and recommendations for dealing with mental health. As was done previous years, adolescents are encouraged to join the conversation and will be part of the conference on Wednesday. Emmanuel Cummings, the university's Deputy Vice-Chancellor, shared similar sentiments as Pron and said the university has also engaged the Ministry of Education to have social workers at schools. He said how parents react to stress and late interventions are all factors that lead to mental health issues. The Deputy Vice-Chancellor said this conference is important for developing a holistic response to mental health issues.
Parenting, which to my mind is a major factor that might have contributed to a lot of the issues that we have in mental health, can also be part of the solution. And so certainly we will listen to those discussions and see what we can learn from that. Persons with disability always at a disadvantage and can become victims of discrimination of all sorts and can have issues with mental health.
Meanwhile, Professor Christina Hoven, who is attached to Columbia University, USA, said persons interested in assisting with promoting mental health and research can get enrolled in the Guyana Research in Injury and Trauma Training GRIT program. This program is offered by UG and focuses on building research capacity on trauma and injury prevention and the promotion of mental health. This is a fellowship program that is conducted for 18 months. Professor Hoven said the research is critical for ensuring persons who suffer from trauma and injuries have good mental health guidance.
What we're doing is trying to go beyond the usual risk factors, and we want to understand and develop interventions to prevent trauma and injury in all the forms. And that includes suicide, which we're highly focused on, but it also includes thinking about how do we do better about all the automobile crashes. And I think I've shown you here in the past that Guyana is at the bottom, the worst when it comes to a lot of indicators.
As part of efforts to target children and adolescents, the Health Ministry this year launched the pilot program on mental health and psychosocial well-being in the development of children and adolescents. This was done through UNICEF. A new mental health legislation and the suicide prevention legislation were also developed to ensure persons are properly cared for. Reporting for the newsroom, Lazina Yearwood.